Well, good afternoon, everyone, and welcome to Adagio's Better Health Outcomes Speaker Series. Hi, my name is Denise Johnson, and I'm the Acting Physician General at the Pennsylvania Department of Health. I'm also a former board member at Adagio Health, and I've had a long and great relationship with Adagio since I worked as an obstetrician and gynecologist in Meadville, Pennsylvania. And I'm very proud to be your guest host today as we focus on a really important topic, behavioral health. Well, it's been approximately a year and a half since the COVID-19 pandemic took hold in the United States, and we all know that it's had a massive impact on people's lives across the country and the world, really. It has also put racial and socioeconomic health disparities in the spotlight like never before, as we see now how different groups have been affected during this global crisis. Behavioral health impacts have been widespread. People are anxious and depressed, and in many cases, significantly more so than they were prior to the pandemic. People have experienced trauma and great loss. Today, we want to talk about how stigma and accessibility have prevented Black people from receiving adequate and ongoing mental health support, and how groups are being innovative and inventive about removing those barriers. Today, we have truly two outstanding speakers joining us, Julius Boatwright and Christina Kroll. First, we'll be hearing from Julius Boatwright. Julius serves as the founder and chief executive officer at Still Smiling. It's an organization that was created to bridge the gap between Black people and mental health supports through education, advocacy, and awareness. Still Smiling's mental health workforce development program, known as Beams to Bridges, also equips Black adults with knowledge, skills, and competencies needed to serve as community mental health workers. Julius is a licensed master social worker who completed a trauma-informed community practice workshop with Duquesne University and their Department of Psychology and the Rita McGinley Clinic. He obtained his master's in social work degree with a certificate in human services management from the University of Pittsburgh, where he also earned a bachelor's in communications. Julius also completed a one-year professional development program for nonprofit executives with Leadership Pittsburgh and the California-based Rockwood Leadership Institute. Some of the awards that Julius has received include the Mental Health America's Social Work Award, Black Enterprise Modern Man of Distinction, the Coro MLK Jr. Distinguished Individual Leader nominee, the NAMI Keystone Pennsylvania Dick J. Vaughn Advocacy Award, the NAAC Pittsburgh Branch Young Person of the Year Award, Allegheny County Council Proclamation, the Pittsburgh City Council Proclamation, Pittsburgh Magazine Pump 40 Under 40, University of Pittsburgh COVID-19 Hero, the Be Me Community Genius, and Pitt School of Social Work Distinguished Alumni Rising Star Award. My goodness. Julius, we're so pleased to have you with us today. I'm going to turn it over to you for your presentation. Thank you.
Thank you so much for that introduction. I always have to pinch myself and ask who in the world are they talking about with that introduction? You get so lost and immersed in the work that you forget all of the things that you've done, and the people in the community, what they have really done to uplift this work and support Black mental health, not just at a local and a regional level, but now really at a national and an international level, as we're seeing even with the Olympics as well. So it's always amazing to see that. So I am truly honored and grateful to be with you all today. And I always like to start off by talking a little bit about the why. I think that's one of the most important ingredients to the work that I do, is really centering on why I do it. And I think in times that we're in like now and even going through the pandemic, it is critical and vital for us to get back in touch with that why and what motivates us and inspires and compels us to do the work that we do, particularly around behavioral health. So I am 38 years old now, and I know that since I was a teenager, a young Black boy, I know that I've struggled with my own mental health challenges. And I've also thrived with those mental health challenges as well. I never had the appropriate language for them when I was younger. And now that I have the language, the context, and the knowledge to really be able to understand mental health and wellness, different mental illnesses, I know exactly what I'm feeling, most of the time, why I'm experiencing those things, and even more so, how to thrive with mental health challenges. So it is not a debilitating label. It is not something that I'm always looking at it through a strengths-based perspective and how I can utilize my mental health challenges to be more vulnerable, to connect with more people, and to continue to do the work. I also had a very, very dear friend of mine, someone who I considered to be a brother, passed away, died by suicide. We went to school at the University of Pittsburgh. Another young Black man that just had an amazing and promising future, a great spirit, and he was just an all-around phenomenal human being. And mental health challenges were something that he faced, and we talked about pretty often. But just knowing that it was something that he went through, and he struggled with it as well, was another one of those big motivators for me to really pay attention to this work and really be intentional about supporting the mental health needs of Black people in our communities. And last but certainly not least, I spent some time as a community based mental health therapist. And in doing that, I really had a chance to see up close and personal the disparities and the barriers that exist when it comes to accessing behavioral health support within the Black community. I remember working with families and just seeing firsthand how they didn't have adequate transportation, they didn't have adequate levels of insurance, and there was also the word that we spoke about earlier, a lot of stigma within the Black community, and that still exists today. But there is more of a level of excitement. There's more awareness within the Black community, and more folks are getting connected to behavioral health resources. So just wanted to talk a little bit about the why, so people know that this is work that is. I don't look at it as a career. I look at it as more of a calling, and it's something that I'm extremely passionate about. So when we think about what happened over this past year and a half through the course of this pandemic, we also had a racial reckoning of sorts that happened as well. And we saw all across the globe more people being mindful and intentional about supporting, uplifting, and celebrating the needs of Black folks all across the world. And with that, we also saw the mental health and wellness and behavioral health needs of Black folks. They were exacerbated by the pandemic, through loss of job, through loss of life and loss of loved ones. All these things that are directly connected to the social determinants of health, they were further exacerbated within the Black community throughout the course of the pandemic. So what we saw firsthand at Still Smiling was that it was making it that much more difficult for folks to identify what kind of treatment and supports would benefit them, to be able to afford those treatments and supports, because some folks did not have appropriate levels of insurance, and if they did, they could not fully afford the co-payments that came along with receiving their medication to help them better manage their mental health challenges or diagnosed mental illness. And then there's still the stigma as well. Even though folks are grieving, we're grieving the loss of routine, we're grieving the loss of a lot of different things in our lives, there is still a stigma that we are chiseling away within the Black community. So in terms of Still Smiling, some of the things that we did throughout this process to try to um, combat some of those barriers and try to continue to provide intentional and meaningful support to folks, I do want to speak to some of those right now. So one of the things that emerged that I've been just really excited about, our staff is really excited about, it emerged in the pandemic, and it's called the Black Mental Health Fund Referral Program. So we started to see so many more Black people at the local and regional level reach out and say, I want to be connected with a mental health professional. The impact of everything that's happening right now has moved me to a point of saying, I need help. I'm ready to get that support. And we heard that Still Smiling is a place that can possibly help us navigate that landscape. So the Black Mental Health Fund does a number of different things. One, we have what's called our pre-treatment experience. So we know that folks experience pretty extensive wait times right now because the majority of our behavioral health systems and providers are overworked and being pushed to the point of burnout. And what ends up happening is, as a result of that, community members and referrals end up waiting long periods of time before they can actually get connected with mental health or behavioral health treatment. So, this pre treatment experience that we've created is more psychoeducation, therapeutic support by both provided by both clinical mental health professionals and also general wellness practitioners as well. So someone may be talking about art therapy, they may be doing journaling, yoga, they may be talking about what to expect in therapy and setting people up for success so we can see higher utilization rates when people actually start engaging in treatment. They can explore some of their fears and reservations about going back to therapy or starting therapy for the first time. The whole point of it is to give people support while they're waiting to receive that clinical level of treatment if that's what's deemed necessary for them. And we're already hearing some phenomenal feedback from folks that the pre-treatment experience is really helping them to bridge that gap while they're waiting to be connected with a clinical level mental health professional in a more formal setting. And then the Black Mental Health Fund, another part of that referral program is that we help to offset the costs related to receiving treatment. So a large amount of the folks, Black community members that we connect with, are coming to us, even if they are insured, they're having a little bit of difficulty affording their co-payments for treatment. And if folks are underinsured or uninsured, we provide financial support to ensure that they get the medication that they need to support with their mental health and mental illness. And we also provide that financial support to cover some of the sessions as well. So we've gotten just so many positive responses. It's always a challenge because it's never a linear process, and it's a case by case, individualized process. Even though we have our own structure to it, people are coming and engaging with us at different points in times of their lives and different points in times of really understanding what therapy is like. So we always have to meet folks where they're at in that process. But our Black Mental Health Fund referral program really emerged after the death of George Floyd because so many Black people, again, all across the globe, started to say, I'm really in need of mental health support, and I want to reach out and I want to get that support now because of everything that's happening. So that has just been a beautiful program that has been developing for us over the past year and some change, and we look forward to the continued growth of that program. And I do just want to speak very quickly to our Black Mental Health Workforce Development Program, as was mentioned earlier, which is called Beams to Bridges. So that is a training and support program to give Black adults the knowledge, skills, and competencies, and also comfort and confidence to be able to go out in their community and serve as community mental health advocates. So they are certified in mental health first aid. They're learning about the social determinants of health. They're building their own emotional intelligence and emotional regulation skills. And they're not tasked with diagnosing. They're not tasked with providing therapy. They are put in a position to just be themselves, use their own natural skills along with the training that we provide to go out and talk to other Black people in the community about mental health and advocate for it and really say, you know what, it is okay to receive that support. And let me talk to you a little bit about my experience and what I've learned throughout this program and how getting connected with a therapist or a psychiatrist or a host of behavioral health professionals has benefited me, my family, my loved ones, the folks within my neighborhood through various community events that we do. So that has been a very, another phenomenal program of ours. Those folks receive workforce development stipends. They receive social service referrals as well, because we all know it's not just behavioral health, it's all of these other social determinant of health challenges and opportunities that come along with it, related to education, related to housing, related to food insecurity. So we do our very best to maintain community partnerships with trusted community organizations and try to make those referrals in a timely and efficient manner. So we're actually going to be having our inaugural cohort will be graduating here the last day of August. So they will be completing the 2-year training program. And now they're at a point where they have been activated. They're going out into the community. They are not providing, again, crisis support or providing any therapy. It's really someone who has can provide an empathetic ear, who has a basic understanding of the mental health landscape, and somebody who can really normalize their lived experience and say, here's what I've learned, and here's how you too, as a Black person in the community, can benefit from getting mental health support, having these conversations within the church, at the barbecue, at the sporting events. So now it's not this thing that is stigmatized, it becomes commonplace, it becomes a lifestyle, it becomes something that all Black folks in our neighborhoods throughout the region and throughout the Commonwealth are speaking about. It becomes second nature. So it has just been a phenomenal experience. And the final remark that I will share before we transition into the next part of our program is that I would just say that I would encourage everyone to be mindful of how we are incorporating Black and brown folks into the overall treatment spectrum. So whether we're talking about the referral process, peer support, recovery support, drug and alcohol, community engagement, whatever that process looks like, we always have to continue to ask ourselves, are we including Black and brown folks in this process? Is their voice being celebrated and honored and truly paid attention to when we're developing these policies and these procedures? Are we building strong bridges between community-based organizations and more traditional medical model systems so we can actually maximize our impact and the understanding of the value of behavioral health support and treatment in our neighborhoods, not just for some people, but for all of us? So again, I'm truly grateful for this opportunity, and I look forward to sharing here for the rest of the experience with you all this afternoon. Thank you.
Wow, thank you so much for that, Julius. I really appreciate your honesty about your why, about mental health struggles and struggles in family members and friends. I think that you're right. We do need to get rid of this stigma. Mental health issues need to be normalized like physical health issues. We need to be able to talk about them in a non-judgmental way and empower people to be able to seek those services. I really was impressed with the really creative solutions that you've come up with. I mean, for a long time, we've had problems with the wait times to get into access these mental health services. So your creative solution for engaging people while they're in that waiting process is really phenomenal. And also the workforce development, creating a group of people that can support in a not a clinical medical way, but extend that support on really is so innovative. Thank you so much for sharing that with us. I just want to remind everyone that you'll have a time to ask questions a little bit later on. So if you have questions for Julius, you could go ahead and use the Q&A button and put that in. And we'll be coming back to those questions a little bit later on in the program. So I'm going to switch gears a little bit now and move on to our next speaker. And our next speaker is Adagio Health's own Christina Kroll. Christina is a behavioral health clinician who works out of the Adagio Health's office in Erie, Pennsylvania. She's a licensed professional counselor as well as a nationally certified counselor. Her career background is in mental health, integrated healthcare, trauma-informed care, and working with children, systems, and families. Christina is originally from Bethlehem, Pennsylvania, but right now she's actively serving the Erie community. She's doing targeted work around Black women's health and wellness, and she's a 2017 winner of the Boots on the Ground Youth Work Award from the city of Erie. We are looking forward to hearing Christine's presentation. Christine, I'm going to turn it over to you right now.
Thank you so much, Dr. Johnson, and thank you, Julius, again, for the information that you shared around the work that you were doing out in Pittsburgh. So I am just going to share my screen because I do have a PowerPoint presentation, and I will begin. So again, thank you, Dr. Johnson. And I am going to get into my part of the presentation. As stated, I'm Christine Kroll. I'm a behavioral health clinician, and I work here for Adagio Health out of the Erie Medical Office. And today we're going to be taking a deeper dive, a closer glimpse, and look into the behavioral health services that we are providing here at Adagio, and really how we're looking to meet our patients' needs around behavioral health and minimize health disparities. So as you may or may not know, Adagio provides a wide array of services. We're really known for our reproductive healthcare services. So we have OBGYNs, we do perinatal and prenatal care, family planning, we do STD and STI testing, we have nutrition services where we really work to address food insecurity. So we have breastfeeding support, WIC, SNAP, and we also do on-site food cupboards in our offices. We have preventative health screenings around breast and cervical cancer screening. And with that comes nicotine and tobacco-free Adagio, where we're doing nicotine and tobacco cessation counseling. We have immunizations, vaccinations. So again, really looking to meet the needs of the patients that we see throughout Pennsylvania, Ohio, and Western New York. So why behavioral health? Why did we decide to introduce that piece into the services we are already providing? So our why really came from an expressed need from the patients we were seeing, right? So our patients were verbalizing, hey, I'm struggling with this, that, and expressing that they are having behavioral health needs. Also, our nurse practitioners and medical assistants were seeing these needs themselves with our patients. So in 2020, we were able to launch our behavioral health programs in addition to the services that we were already offering with the leadership of Becky Ludwig, our Senior Director for Integrated Services. And here are some pictures of some of our behavioral health staff. So we have Kayla, one of our care navigators out in Butler, and Amanda, one of our care navigators out in Indiana, collaborating with one of our nurse practitioners in the medical office. So that's right, we got our behavioral health up and running in 2020. So really in the peak of the pandemic that we're currently living through. So that highlighted even more the need for behavioral health and the importance of having integrated services to support the needs of our patients. So what does our behavioral health specifically look like? So we have behavioral health clinicians, like myself, who are master's level licensed therapists working in the medical offices to provide therapy. And then we have care navigators. So care navigators are our staff who work with patients across needs. So they're referring patients to services to get them connected, to support their needs. And those can be existing services within the community or services throughout the whole Adagio umbrella. So even though the care navigators work out of the offices that are listed on the slide, they can help patients throughout the Adagio and across the Adagio footprint. We also received the HRSA grant from the federal government, so the Health and Resources Services Administration grant for rural counties opioid response program for neonatal abstinence syndrome. So we're working to pilot our medication for opioid use disorder bridge scripts in Lawrence, Mercer, and Venango counties. And last but not least, we have mental health first aid. So we also have health education services. So some of our health educators and our behavioral health clinicians are certified mental health first aid trainers. So we go around to organizations, training their staff and equipping them in mental health first aid. So what does it look like mixing medical service with behavioral health services and integrating care? So as we know, the Western medical model really focuses on specialization. So the behavioral health folks, we're over here and we really specialize in behavioral health and mental health and substance use treatment. And sometimes that can lead to siloed care because as we know, people are complex, right? Humans are complex and they have various and arrayed needs. So sometimes the model that we currently normally use in healthcare leads to fragmented care. And what we see is people with multiple needs have multiple appointments in multiple locations with multiple providers and multiple dates. And it really just increases the barriers to quality healthcare. So what we're really looking to do with our integrated services here at Adagio is to develop a comprehensive plan of how to address the needs of our patients under one roof. So there are a couple different models for integrated behavioral health. So we use the SBIRT model, which is screening, brief intervention, and referral to treatment. So we use an expanded version of SBIRT. And what that practically looks like is when patients come in for their annual exams, their initial visits, or other appointments where it's deemed necessary, they are screened by our nurse practitioners and our medical assistants. And then from there, since the behavioral health clinicians, we're right here in office, we enter the exam room and we are able to screen the patients, do some brief assessment, introduce ourselves, talk about the different services that are needed. And depending on level of care, we are able to make referrals for them to get connected with whatever services that they might need. And if that service is outpatient therapy, short-term therapy, they can receive that right here in office. So again, some more pictures of our staff doing the work. That is me, Christine, coordinating with one of our nurse practitioners here in the medical office. And this is Missy. She is one of our care navigators out in Uniontown. So let's zoom in on the needs and what we've seen here at Adagio. So patients, especially in the past year and a half, have presented with life stressors, right? So they're overwhelmed, they have a lot on their plate, and they just really need help problem solving and navigating the different things that they're experiencing. We have patients who are in situations of intimate partner violence, people with housing concerns in need of income, employment, parenting support, food insecurity, which is something we can really address since we already have food insecurity programs within Adagio. And specifically from the behavioral health side, some needs that I see are patients presenting with symptoms of anxiety, depression, people who've experienced trauma, because we have reproductive health services, people coming in with those reproductive health, mental health disorders like perinatal and postpartum mood disorders and anxiety, We see folks who are struggling with substance use disorders and people with just general mood disorders and much more. So I work out of the Erie Medical Office, but as we know, Adagio services span across age, gender, orientation, identity. We typically see folks who are uninsured and underinsured, so we make an effort to make sure that our services are aligning with those folks who are from underserved communities or in populations who might be vulnerable. We see women, Black and Indigenous people of color, so Black and brown folks, refugee populations here in Erie. We have a large resettlement community, so we see a lot of folks who are new Americans, refugees, immigrants, folks who might have financial and income concerns, LGBTQIA folks, people who are pregnant and are birthing, and people who have served in the United States military. One thing we've really put a focus on is providing culturally competent care. So as we know, part of the speaker series is wrapping up the month of July, which is Black and Indigenous People of Color Mental Health Awareness Month. But this is something that we put emphasis on 24/7 and throughout the year, especially with getting our behavioral health programs up and running. We really wanted to make sure when we say quality care that we're including cultural competency. Because as you see, we work with patients from a variety of identities. So we want to make sure that the services we provide are quality. So some of the training that I've found helpful in this role is the Veteran Ready Provider Certificate through Psych Armor Institute. Purple One right here in Erie County is a certification to help those who are in situations of intimate partner violence. The National Coalition for LGBTQ Health has an LGBT Health Training Certificate program. The University of Southern Florida offered a very interesting diversity, equity, and inclusion certificate that I was able to take part in. And Forward Allies out in Pittsburgh has a reproductive mental health certification provider certification cohort that I was able to take part in, and I'm currently in progress of working to become a certified reproductive mental health provider. So again, making sure that we're making a prioritized effort to put culturally competent care at the forefront. And my identity, right, as a Black woman, it warms my heart to work with so many patients from communities of color who, when I walk into the exam room, their faces light up. They say it. They say, I am so excited to work with a professional, a provider who is Black, who understands some of the struggles, who understands some of the disparities that my community is facing, especially within the past year. So I think historically, behavioral health has been looked at as something that happens to those people over there, as maybe some sort of obscure thing, but that can be further from the truth, right? 1 in 5 adults are diagnosed with a mental health disorder in any given year, and almost half of all adults in the United States will experience a mental health challenge. So this is a reality. This is something that's happening in our communities, to people who look like us, to people who don't look like us, to our families, our partners, our friends, to ourselves, to the patients that we work with. So again, we wanted to make an effort to meet people where they are and provide services that are realistically addressing the needs that we're seeing. About 40% of people with mental health disorders sought no treatment at all as of 2019. And as Julius stated, that can be due to a variety of barriers, right? Access to care, how do I get there? What exists? Where is it located? Will my insurance cover it? And if I'm doing some sort of self-pay, how do I organize that in my hierarchy of needs, right? In terms of paying out of pocket for therapy. Education in terms of knowing what the different mental health providers are, what services do they do, what are the different types of treatment, and last but not least, most importantly, stigma, right? So attitudes and beliefs about what behavioral health care looks like, what it means to receive behavioral health support, and attitudes and beliefs of providers and the medical system, and how historically, how we've treated communities of color. So all of that comes into play when we think about why people aren't receiving the behavioral health care that they need. as we know, the COVID pandemic that we are currently living through has had a significant impact on behavioral health, and again, has highlighted that need and that severity of behavioral health support. So what we're really looking to do, because we know the pandemic was a perfect example of how not all Americans are affected by pandemics and by health disparities in the same manner, right? It disproportionately impacts communities of color. It disproportionately impacts people based on their income, based on where they're located, so rural communities, inner city communities. And we know mental health challenges don't discriminate, right? Anyone can experience a challenge at any time, but it's important to keep in mind that identity can impact your access to care and the quality of care that one receives. So with getting our behavioral health up and running, we've really been looking at addressing these social determinants of health that we were already addressing, but really adding that behavioral health piece to see if we can have an even more significant impact on supporting our patients in a way that's whole person focused and patient centered. Many patients have expressed how reassuring it is to know that multiple providers from different disciplines are working on their healthcare and their needs, and they're not just another name in the chart, right? When you integrate services, you really have to do a deep dive into the needs of that patient and how to support the people that we work with. So it's been a great experience partnering together to share expertise and share resources. And it's really been beneficial in creating a culture that supports the needs of our patients. So I did want to end with a quote from the World Health Organization. Health isn't just the absence of disease. Health is a state of complete physical, mental, and social well-being. So again, thank you all for having me. And I'm going to turn it back over to Dr. Johnson to continue the rest of our program. Thanks.
Great, thank you so much, Christine. I have to say, I love the integration of behavioral health. I think, when I trained back in OBGYN, I trained a long time ago. I'm a lot older than all of you, but we learned how to practice medicine in one system at a time. And so that we were addressing the immediate problem that's within our specialty. And so we didn't really have a good mechanism to incorporate those other issues that we know all people have. So our referral mechanism was very complex. And as you said, it led to really siloed care. So it's really great to see this transformation in the healthcare delivery now, where we're really taking into account the social determinants of health and the other issues that impact the patient's ability to follow a treatment plan or to improve their health. So really exciting to hear all of the different things that Adagio and others are doing, and the way that everyone is really looking at the whole person care and integrating many members of the team that could support wellness in patients. So really refreshing to hear and very exciting to hear about all of the work that's being done. So this is the time in our program that we're going to start taking some questions. And I know that I've got a couple of questions that are in the Q&A already. And the first one I'm going to read was really mentioned by a couple of our viewers already. So this week, in the international spotlight, we've noticed young Black women's struggle with mental health that we've not really seen before. We've seen Simone Biles and her public struggles at the Olympics, and she's been very brave and honest about this. But we've also seen Naomi Osaka and her struggles as well. So the question is, can this national spotlight on especially these two young women and their mental health struggles, can that help us advance the conversation? And I'll look to both of you to kind of weigh in on your thoughts.
Thanks, Julius. I definitely think it can advance efforts in visibility of humanity, right? In the humanity of Black folks, in the humanity of Black women. I think for so long, And I think that's part of what the Black Lives Matter movement was saying, is we've seen ourselves in society, right, has seen us as super women, as those who need to persevere, as people who are resilient, which is wonderful, right? We are all of those things. But I think these young women stepping out in the forefront at the peak of their careers and things that they've trained for all their life to prioritize self-care is revolutionary. I think it's a beautiful thing. And I think it really, it's always existed, right? I think people behind the scenes have struggled, but it's been hard to verbalize that need, and it's been stigmatized. So I think it's beautiful that they're coming out and saying, hey, I'm human. I need rest. I need to do things to prioritize my mental health. And it's inspired me. So I know it's probably inspired people all over the world.
I would just echo all of that. It's really letting folks know in terms of accommodations, right? When it comes to employers, what do employers need to be doing to make sure folks that work within their organizations and agencies and spaces have the accommodations that they need to be productive, to be well, to be whole, and to feel like they act their humanity, right, as you said earlier, actually matters. And I'm just really excited about the message that it's sending to little Black boys and little Black girls who are, whether they're athletes or not. It's saying, wow, I can take time to feel my feelings and to be transparent and to be vocal about that, right? I just think that's a really beautiful thing. And Simone and Naomi are really opening up a global conversation about having permission to do that.
Great, thank you both for that. Question number two, both of you talked about the stigma and how difficult it is for people to access services because of that. How do you think we can get past the stigma and make sure that people have more access to mental health services when they really need them? We'll start with you, Julius.
Start with me here, switch it up this time. So I think just as we are doing, right, having the conversation and talking about it every single chance we get, number one. And number two, I think reframing and rewriting that narrative ourselves. One of the things that we're seeing in community is that the Black folks we're engaging with are saying, we absolutely want mental health support. We absolutely want the treatment. Here's what we need it and want it to look like and to feel like, and really owning that process. So I think one of the ways to combat stigma and rewrite that narrative is to start telling that story that Black people are saying, yes, we want to get treatment and we want to have ownership in that process because we are the experts in our own lived experiences. So how do we now come alongside a primary care physician, or how do we come alongside OBGYN and really be a part of that process and have like an educated, celebrated, and honored voice to be able to determine what treatment looks like for ourselves and our families?
Great, thank you. Christina?
Definitely, I definitely agree with Julius. And to add on to that, I think visibility is also something that can help to decrease stigma. I think putting mental health in places where it's not treated as something that's obscure, and in places where, like what we're doing now, where it's on the forefront of healthcare, that people can see exists and that they can engage in. And I think visibility of Black folks who are currently involved in mental health services and support, and Black folks who are mental health professionals. I think that can really help to decrease some of the stigma, because I think when our community has been othered for so long, when they feel a sense of belonging and a sense of ownership that they're a piece of the mental health system, I think that's when we'll start to see more changes in terms of stigma, and knowing that you can do all of the things that we've already been doing for centuries that promote our wellness, and we can add behavioral health on as a piece of that.
Great, thank you for that. I think we have time for one more question. And so the question I'd like to pose, during this pandemic, all of us have experienced loss and grief, and we've been concerned about our health, that we've been concerned about our family's health, we've been concerned about our finances, we've been concerned about businesses. So many concerns and cares, our children as well. So how do we know when the symptoms that we're having, the sadness, the grief that we're having is something serious that we need to seek help? What are the signs that we need to look for to say, I'm not just down, this is something that I need to have some help with?
That's a great question. I really like that question, right? Because we're human, right? It's normal, especially in these unprecedented times, to feel sad, to feel scared, to feel anxious. But when do you know, right, that it's something that I need to seek help for? And I think some things to look at are length of time, right? So if your symptoms last beyond your typical, like knowing what your baseline is of, okay, I feel sad about this. And if it lasts beyond that length of time, that's when I would consider seeking help. If you're having any thoughts or feelings that are different than what you normally feel, and that might be scary to you or even interesting to you, of like, where did that come from? I would explore that, right? It wouldn't hurt to see a therapist and kind of talk through that with someone. And definitely, if you're having any signs and symptoms that make it feel like you want to harm yourself or potentially could harm someone else, that's definitely a situation where I would seek help. But those are some things that come to mind for me.
Yes, and I will add and echo just really thinking about wellness on a daily basis, mental health and wellness. So, really trying to make it a lifestyle as we're navigating our everyday lives to try to really, in theory, as much as we can, get in front of those crises. We don't necessarily know when or how they're going to happen. That if anyone had an answer to that question, our industry would be so much more well off. And oftentimes the challenge is we don't know what may trigger someone. We don't know what may set them on that path of having those mental and behavioral health struggles. If we can be proactive as a village, as a collective, and really give ourselves and give each other reminders. So for me, sometimes when I am in a slump, it's difficult for me to even follow the plan or do the things that I've set out for my own wellness, to see a therapist, to journal, or do whatever those deep breathing activities that I do. So really holding ourselves accountable for checking in not only with ourselves, but checking in with other people. And I always tell some of my friends that I went to undergrad with at Pitt, I tell them everyone has mental health. So as we talked about earlier, this whole idea of othering, we can't other something that we all have to some degree. So it's just, where are we on that spectrum of mental health and wellness, and what helps us to maintain that stabilization. So really developing a lifestyle of mental health and wellness, to try as best as we can to get in front of a potential crisis if that were to arise.
Great, thank you so much. This has been really enlightening and really inspirational. I think that both of you have been so open and honest, and it's great to hear about all of the work that you're doing to support all of our mental health. It's great to know that this work is being done, and we want to make sure that others are aware of that as well. I really have to thank Adagio for putting this program on. Again, as you said, the awareness and being able to have these open conversations will help people to understand that mental health wellness is important for all of us, and all of us do struggle at some time. And so it really should be thought of as another part of our health. Having a mental health issue really shouldn't be different than having a headache that you need to treat. It really needs to be normalized, and people need to be able to seek those services. And thanks for the creative and innovative ways that you guys are offering services to people and making sure that we address the disparities that that we know have existed but have been really heightened by this pandemic. I think a lot of that has become a lot more apparent to us, and we need to really make sure that we're reaching out to get those communities and groups that have been underserved. Again, thank you so much, Adagio. And I have to say, I'm ready for this pandemic to be done, as I'm sure all of you are. And I hope that you will do everything that you can to protect yourselves and your families, their mental health, but as well their physical health. I have to put a plug in for vaccination because right now we're seeing our numbers go back up, and that's a little bit disheartening. I think we had felt that we're really moving well on this pandemic, but there's still room, there's still time to make sure that we get our loved ones vaccinated and keep them safe. Thank you again, all of you, for participating. Thanks for bringing your openness, honesty, and your expertise. And I hope you guys have a wonderful summer. And to all of you watching, thanks for joining us, and take care of your own mental health. Thank you. Bye-bye.